the first thing that they usually ask is tell me about yourself. And kind of the way to think about this question is just kind of like, how did you get into nursing? Like what initially sparked your interest and like what really solidified that this is the right path for you. And then kind of like what, like if you've graduated, got your NCLEX, and then like what like clinical rotation led you to hope for, like what kind of job type of thing is usually how people like have
Okay.
the flow go.
That would have been good to include, and I'm bad at that question.
Yeah, because it's like, do you want to know that I have two cats and like I like to eat a lot of pasta and then fall asleep
Yeah.
after? Like, what do you want to know?
Yeah. So I was an LVN for 4 years and received my RN license back in July of last year of 2022. I actually got into nursing because my sister was a cancer patient when we were younger, and she was a patient at Children's Hospital. And I really admired the staff that helped take care of her, and I really wanted to be like them one day. So that's when I started pursuing the path of nursing. I've been working at an allergy and asthma clinic as an RN since June, and I was also promoted to a lead position. We mostly, in my position, I do a lot of infusions as an RN, but we also do a lot of allergy testing, immunotherapy, oral food challenges, and we work with kids of all ages, so from like months old to like 99 years old.
Very cool.
I should have said more.
So say a little bit about like, I guess right now you're hoping to get preferably a NICU position. Just say kind of a little bit about like what sparked your interest in like the NICU population and like why, like what interests you in hospital. Um, just to kind of, because it's like on a path and it just stops, like bring
Yeah.
us to like why you're here today kind of thing.
Okay. So I went to college and we did most of our clinicals at hospital, and I was able to do about, I believe it was 36 hours in the NICU there. And the nurses there just seemed to really love their job there, and they've all seemed to have been there for 10 years or more. And I was really impressed at how long the staff have worked there and how happy they were. And I also really liked the aspect that you're taking care of the infant as well as their parents. And I love that there's like a lot of education going on between educating mom on breastfeeding techniques, or just educating both mom and dad on how to properly bathe the infant and other techniques as well. So I really got into that. I just fell in love with that unit and how happy everyone seemed. And I know there's stressful times too, but I just really liked the environment there.
And then say a little bit about, was that the same hospital? Sorry, what is the name of the hospital? Okay, so that shows. Maybe just say something about how they spoke very highly of the new grad program, and you'd love to get started at a place that's such a supportive environment for new grads to start their careers or something. Yeah,
Okay.
I think that has like a nice like beginning, middle, end to it. Can you tell us about a time that you had a difficult patient?
So when I was working as an LVN at a nursing facility, I worked the long-term care side most of the time. And during the pandemic, I had a patient who was nonverbal. She started stealing other patients' food as well as like their stuffed animals, and it was just a really new behavior for her. And she also had a hard time communicating her needs because she was nonverbal. So we were trying to figure out what was going on. So I would give her extra snacks in between meals to see if that would help, and it did not help. She was wheelchair bound and started leaving the facility, and I would find her out in the parking lot, or sometimes like people in the surrounding neighborhood would bring her back if like she went missing. So I was like, what is going on? So I started taking her for walks, which helped a little bit. And then it clicked that her son, who would visit weekly, sometimes with the grandkids, wasn't coming because of COVID. So I think she was just really missing him. So I had called him and had him talk on the phone with her. And then we arranged for him to come meet with her through the glass door of her room. So he started coming weekly just to see her through the door. And after that, her behavior stopped. So that was like challenging trying to figure out what was going on with her because she was nonverbal, but we narrowed it down eventually.
I love that you say the nonverbal thing, because if you do the NICU, your patients will be nonverbal and you have to kind of like figure it out. I like that you mentioned that. So um maybe finish it off with something about how like sometimes when you have it just taught you sometimes when you have patients who are difficult and they're sort of acting out in ways that are making it difficult to give them the care that they deserve, that just kind of taking the time to assess what emotional need they're trying to meet and like struggling to meet for themselves is, and seeing if you can find a way to help meet that need so that they can get the care that um that will help them have the best outcome.
Okay.
That just some way to bridge it from like, you handled that situation beautifully, but like, what about all the situations that are going to be so different? Like, what
Mhm.
approach is going to fit everything? Cool. And then what if they ask, can you please tell us about a time? They'll say it different ways. They'll say like a time you went above and beyond, a time that you provided compassionate care, like a really fulfilling moment in your career, or something like that.
So at that same nursing facility, I had a patient and she was actually paralyzed from the waist down, and she was newly admitted to long-term care. I believe she may have been living at home prior to that. So she was really anxious in this new environment. She had a son who lived really far away, who also, so he was just extra busy and not visiting her as often as she had hoped. And she was very coherent, alert and oriented times four. And most of the other patients there had dementia or Alzheimer's. So there wasn't really anyone besides staff that she could connect to. So I would try to at least spend 5 minutes of my time talking to her. And if I had extra time, she liked to have her like legs massaged. So I'd help her with that and put lotion on her legs or help brush her hair if I had any extra time, which it really helped strengthen the bond between us because she had a lot of trust issues because she had a history of sepsis from her urinary catheter. So she had a lot of problems with that, and one day it needed to be changed, and she wouldn't let any of the staff do it. So when I came on shift, I spoke with her and educated her on why it's important that we get it changed and the steps I would do, and make sure I was doing the sterile technique just so we could prevent her from getting a UTI. So she let me change it, luckily, because we had that bond. But she just had a very big fear of getting sepsis and dying. I felt like it's like important to build a relationship with your patient and their family too. So you have that trust so that in difficult situations, you can like get through it together.